Hi, Julian. This is Stephanie Russell.
In my toolbox, I have decided to put in my cardiology stethoscope, and not only because I use it every day, but also because it is a step below an automatic stethoscope, and because I have issues with my hearing, I find that it helps me hear what I need to hear each day.
And we're going to talk about my toolbox for the assignment that you gave us. So, first thing we're going to look at here is I have a card. This is front and back. Um, it's wound management, so it kind of talks about the staging and the Braden scale. So, like the sensory perception, the moisture, uh, or activity, diet, things like that. And it kind of gives me an outline of what each number is. See, the Braden scale is like a scale to 20 or something like that. So the one side of this card is going to give me the Braden scale for predicting pressure wound risk. And then the other side here talks about guidelines for staging the pressure ulcers, which the wound care nurse at Southlake said they're now called pressure wounds. Um, so by keeping this card with me and in a toolbox, no matter where I work, whether long-term care or in a hospital setting or even in a clinic of sorts, I can kind of take a look at this if I ever am stuck between which stage, or if it's unstageable, or if it's just a deep tissue injury.
I also have in my toolbox my therapeutic nurse-client relationship. It is the practice standard from the CNO. And I chose to put this in here because it is what I struggle most with. I struggle talking with the patient, and it's something that I need to be working on when working with the patient. So this is definitely going to help me moving into praxis and moving into the nursing profession.
Moving on, so this wound resource, and we're going to see some more online resources. These uh, these and other resources are going to be very meaningful to me and very helpful as I want to be a public health nurse, and I want to be doing health teaching, health promotion, and more kind of working with schools and kids and sexual health and mental health, but doing a lot of health promotion and health teaching. So where these resources are very wound and ostomy specific, um, these three here, the JAMA Network, CINAHL, and Medscape, are going to be really good, scholarly, peer-reviewed websites that are going to provide me with articles and journals that are going to be very, very useful to me in the future when gathering information, when building my knowledge database.
I also have a self-reporting form. I have this in here because I find that because I have a history of seizures, it is extremely important for me to self-report to the CNO and to the union and anyone I work with, letting them know that I have a history of seizures, so that way I'm protecting myself and I am protecting my patients if anything were to happen.
So as you see here, this is a pharmacy tips for nursing students. I got this sheet from a fellow nurse when I was doing my mental health rotation. It was probably the very coolest thing she ever gave me. So, so with the ACE inhibitors, it can give you kind of side effects here, gives you the suffix, gives you some very common contraindications, talks about the ARBs and how they're sartans, diuretics, beta blockers, gives you right here it says the OLOLs, and then it gives you major contraindications, so it can cause bradycardia, can worsen asthma, and then over here it just kind of gives you common drugs, so like your brand name, generic names, and then just some tips. So I thought this was a really useful piece of paper that she gave me, and I decided to put it in my toolbox, as you can never have too many tips on drugs.
Some tools that I have found that are going to really be helpful for me that are in my toolbox. I have the mental status exam cheat sheet, and I found that this is going to be helpful to me because even though I don't plan on working in mental health, I find that anywhere I go, I could be exposed to somebody who is dealing with mental health issues. For me, it is important that I'm well aware of the mental health, that I have some understanding, and that I'm going to be able to help them get the help that they need and be able to recognize where they are.
This is another tool that I got when working in mental health. This is actually from, I believe I actually got it from Waypoint. But when it talks about de-escalation training and advanced de-escalation training, I believe that this is something that's very important when it comes to just working with the public in general. We all know that there's a high incidence of mental health in the general public, and when working with them, if a situation were to erupt where, it would get tense and things like that, you'd want to be able just to go in, be able to settle down the situation, no matter where you work. So I think it's really great to have some kind of de-escalation training, although this one may be a little intense, but I still thought it to be in my toolbox because I have seen it before, and I think it would provide amazing tips and reminders.
I also have in my toolbox my ears, nose, mouth, throat assessment cue cards. Although I don't use them often, it is probably what I'm going to struggle with the most. I have not had the chance to do an ENMT assessment since lab class, so when I go out into the field as a nurse, I could come into a situation where I need to do an ENMT assessment. This is going to be helpful for me because I don't want to miss anything, and it'll give me something to reference back to that I'm able to just quickly look over and understand what I'm supposed to be looking for and what's normal, what isn't normal. Yeah.
Again, with mental health, this is the mental health status assessment cheat sheet that Treva gave us. Just goes over the basics of what you should be looking for when doing a mental health assessment. So it talks about how they look, their rate of speech, their emotional expression, thought pattern, thought form, content, if they're experiencing any hallucinations, how their judgment and cognition is. This is going to be handy for, again, if I work in any facility. If I see any of the things here, like a pressured speech or disheveled behavior or appearance, or unorganized thought patterns, doesn't matter where I work, I'm going to be able to use this to know if a person is within the standard acceptance of appropriate mental health.
I also have a CNO book that has my competencies, my practice standards, practice guidelines, quality assurance, and my scope of practice. If I have any questions, any concerns that I'm not quite sure about, that I need to refer back to any one of these, I'm able to go in here and find it. I will be tagging each one of these areas on what I find most important, so that way I can just have a simple flip through, find what I'm looking for. But this is going to be very helpful as a new graduate.
This here, sorry about it being sideways, is a self-care inventory. This is something that you would give to your patients to ensure that they take time to take care of themselves. Yes, this would be a great tool to offer out to patients, but I also believe that it is very important that I should be doing this myself. As someone who suffers with depression, I really need to focus on caring for myself. So if I have something like a self-care inventory with me in my future, especially during the first year of being a postgraduate, um, if I see it on a regular basis, I will be able to go through it and make sure I'm taking care of myself so that I can be successful.
I also have this little cheat sheet for guidelines of staging pressure ulcers and the Braden scale for predicting pressure ulcer risk. Because I'm hoping to work mostly with elderly people or people who are in the bed constantly and are unable to get up. They're at higher risk for pressure ulcers. Still a little iffy about staging them, so I find that this sheet is going to be very helpful for me to see where they're at and what pressure ulcer stage they're at, and how to go about scaling them and who's at most risk for pressure ulcers.
Yeah. Here's a little article about empathetic listening. Empathetic listening is going to help build rapport and respectful relationships. You can be empathetic when listening to patients, coworkers, family, your friends, just anyone in general. I think empathetic listening is a very important skill to have. So there's 2 pages here, and I think it's going to provide just an additional skill that'll just help me anywhere I go, but it will definitely help me with interacting with family of patients.
The last item I have in my toolbox, which I think means the most to me, because although it does not help me immediately when I graduate, it's a part of me. So I have a surgery cap for in the OR, and this is going to help me because in my future at some point I want to be in the OR. So this is a reminder to myself that no matter where I am in my field, it may not be my automatic choice of where I want to be, but it's always a stepping stone for me. So this is a constant reminder that one day I will go to the OR and I will be an OR nurse. But until then, it's just a reminder that I'm not stuck anywhere, that this is just a stepping stone for me.
The life-threatening conditions in psychiatry. So this talks a little bit about like anticholinergic syndrome, acute dystonic reactions. And the reason that this is in here is that I have to be familiar with these conditions, maybe not be able to directly quote them, but have an understanding of what the signs and symptoms are, because you're more likely to find a person in the community who is having issues with their drugs, their medication for mental health, than you are in a healthcare facility. In a healthcare facility, their medication is regularly monitored, and their behavior is monitored as well. Where if you find someone in the community, they might have been on the medication for a very long time, and they may not notice when things start to change. So knowing what to look for, I believe, is very, very important. Here's the fact sheet from the CNO, requisite skills and abilities. Talks about what we need to learn, what we need to know before we can take the registration exam. So all the information that needs to be developed in a nursing program. And having this here, sometimes when you get through a course, especially at this point where you're 2 weeks out from the last semester, you're about to go into praxis, and you're trying to think, oh my God, what did I learn? I think this requisite skills and abilities, by reading through it, it'll remind me everything that's been taught, as well as going through notes from previous semesters and things like that. But this is just brief, and I think it'll be useful to go through and make sure that I maintain my competence in the things that I have been taught. Another sheet here talks about the different types of dementia. I know when I first entered the nursing program, I had no idea that there was more than one kind of dementia. I thought there was dementia. So this talks about the different kinds and characteristics, how long it takes to, like onset, how long it takes to go from beginning to end, and just if it's a fast onset, slow onset, and what can cause it. So I think this is a good sheet. Well, I'd say for a family, but also you can be providing it for family of seniors, but a lot of health teaching. You can kind of talk to them about if they're concerned about it, what kind of, if they have a history, like family history of dementia, maybe if you know what kind, you can kind of give them tips on what to look for and when to seek additional support. And here I have some stacks of cards here. These are more pressure, wound. This is how to care for them. So this is a sheet I got from my first placement. Kind of talks about where they are, how to stage them. There's little checklists in here to talk about what stage they're at what day, where they are, size, measurement, skin tissue, things like that. So you just click, I can click through here, and it just talks about, so stage 1, 2, 3, and then that last one there is 4. Also here, I have psychiatric medications tables. So what these are, so these are mood stabilizers, so there'll be your mood stabilizers here, the most common side effects and drug interactions. We have our antipsychotics, anti-anxiety, antidepressants, and these will come in handy. So I won't be prescribing any medications, but medication reconciliation and just going over different medications with my patients. Having these on hand, if someone tells me a drug that I haven't heard of in a while, I can kind of flip through and look and see what kind of the side effects are, and maybe find another medication that could be better, and then talk to them about it, and we can go to the doctor and pharmacist and work together on getting onto a medication that's really going to help them and cause less side effects. Thank you for listening to me ramble on, and I hope this is everything it needed to be.